Hi, John Wasson again. We have seen several instances in the past the advantages of the medical home type variables, access, efficiency, and continuity on patients reporting that they get exactly the care they want and need, exactly when and how they want and need it. This slide reminds us that there's another dimension of quality of care, the dimension of patient self-confidence and how it impacts in the lower panel outcomes in patients with chronic heart disease in terms of hospitalization, and in the diabetes diagram, how when combined with excellent care, confidence results in much better results than either one alone. We have many tools to support patient confidence, but the challenge is how to fit them into everyday work. The article about activation of patients for successful self-management lists a number of these tools, such as bubble diagrams in the lower left, problem solving, decisions in the gray, thermometers as shown at Care South Carolina, and of course even Care Vital Signs moves us in that direction. Again, the challenge and what we'll address in this section is how do you do it? Remember this diagram from Care South Carolina where the average educational level is 5th grade and confidence moved quite rapidly in a population of patients from 40%, which is the national average, to close to 100%? How did they do that? The answer was they established a rather simple campaign whereby the medical assistants repeatedly asked over time the question about confidence and responded appropriately. In other words, they did it at the front line, and over time were just smart about segmenting patients, how they'd problem solve, being repetitive over time rather than overwhelming, and constantly monitoring confidence as a marker for their progress. To re-emphasize this point another way, there's a rather strong literature that points out what improves outcomes. Evidence-based evaluation and therapy, appropriately targeted and adapted in intensity to patient need, aim to improve patient self-management and problem-solving skills with follow-up by phone or face-to-face schedule to reinforce the self-management and assist with problem-solving. Fitting that into everyday work can be done. Clearly, as we've shown before, you don't try to eat the elephant all at one time. You start with one group of patients, one segment, and work with them. One way to work with patients is to use a problem-solving sheet, such as this shown, where you ask them how confident they are that this is the right work for them and that they can do it. This diagram, designed by Connie Davis and adapted for this session, reminds us that for many patients, very basic skills can be supported by technologies such as how's your health, getting on the same page with the patient, problem solving, personal health recording, or such things as decision in the gray. Where patients have more difficulties, low confidence with pain and emotional problems, for example, may have to go deeper with phone coach follow-up, group visits, motivational interviewing, and definitely monitoring over time. And then, of course, there's some patients who have very, very deep needs and needs for support, and there often referral is required and special management techniques. So to this point, we've become familiar with Care Vital Signs and the behaviorally sophisticated categories into which you can place patients, such as those who are confident and not confident. And we've talked about some generic solutions that may be applicable to many patients and stepped solutions that may be required by patients who have greater needs. At this point, it's really up to the practice to sit back and ask itself and test, how could we do this given our workforce? And that will be the exercise you'll be asked to do as you try your own campaign for confidence. Observations from other practices who have successfully engaged in self-management support, such as CARE South Carolina example we've shown, have some general observations as shown here: train the entire team, optimize their roles, plan the visits, and plan the follow-up, offer support in a stepped way as described, document the activity, and when possible link to the community. Those are the basic principles. On the right-hand side, in greater detail, indicated by the arrows, are again the drill downs that you need to study in your printout version when you start to engage in improving patient self-management support. One quite successful and off-the-shelf approach for improving patient self-management is to use a campaign for confidence. Basically, the patient is asked to do some pre-work and problem solving with support from a phone coach who can be high school educated or someone in the office, a medical assistant, who reviews what the patient has laid out and then helps them and monitors them over time as they work for their own personal campaign for confidence. When done by the phone, across many practices, of 49 patients referred, 32 were reachable by phone, and of the 32, the success rate was very high. Remember this driver diagram? The checks indicate the areas of the driver diagram we've discussed to this point. We've covered a lot of ground. The next brief talk will drill a little deeper into how do we make our care team better for delivering care that truly enables patients to say, I get the care I want and need exactly when and how I want and need it.